My name is Brian Kallenmeyer. I'm the residency coordinator, residency director for the Department of Early Learning Oncology. I grew up in Western Maryland on a farm, came here for undergraduate and medical school, and stayed on for residency and have been here ever since as a faculty. I got interested in resident education early on as a junior faculty and had the privilege of becoming the residency director. Love living in West Virginia, brought my family, raised a family here, and really enjoy being a mentor and developing resident education is my primary goal. I also do otology surgery, so I do ear surgery as a living. Did a fellowship in Florida and brought those skills back here to treat the patients of West Virginia. I would say the main strengths of our residency program is our collegiality between our faculty and residents. I feel like we've always had very close-knit bonds between our residents and the faculty. Our residents get to enjoy being trained in every subspecialty of ENT and do so in a very collegial and comfort environment. I feel the residents definitely feel close to home with the faculty and think that the training they get when they come out is very good, especially surgically, and that's obviously the big hallmark of our program. We measure success with how our graduates do in training, and we get a lot of graduates to go into comprehensive ENT practice, and with the skills alone they learn in our residency, they're able to care for patients throughout the country, but certainly within West Virginia itself. For our department, we treat really patients throughout the state of West Virginia, the entire state of West Virginia. So those who come from far away from the southern part of the state sometimes don't have any other providers in their area for care. We also treat patients from Maryland, southern Pennsylvania, Ohio, sometimes Virginia, but certainly we have a large catch area to treat patients. Because of the growth of the health system at West Virginia, we certainly have seen the volumes of patients coming in for care increase in time. So we treat patients well beyond the borders of the state, and certainly keeps us busy surgically. So since I was a resident, I graduated in 2015. This department has grown pretty much doubled in size. We had about 8 to 10 faculty. We had 15 residents here when I was a resident. Now we're up to about 18, 19 faculty and 15 residents. So our faculty to resident ratio is excellent. I see continued growth, with the building of our pediatric hospital, the HVI center. I'm sure further expansion in the future and the system growth it will lead to growth in our department, increased faculty for sure in the future. So that keeps our residents very busy and gets the different types of subspecialty training that they require. Those subspecialists will grow in time. One of the main strengths of our department that sets them apart from other residency programs is the fact that all of our training is pretty much within this campus. So the campus in Morgantown, we have obviously multiple hospitals within the campus, but our residents really primarily train here. We do have a VA that our residents go to in Clarksburg, West Virginia, which is about 45 minutes south of here. They spend a few months during their third and fourth years to go down there, but otherwise you're really contained within Morgantown. So that provides a lot of benefits to the residents where they don't have to travel, being on call or travel from a day-to-day basis. I think that's a huge plus. And then Morgantown itself, it's a college campus. It's a very safe place to live, practice. It's a very rewarding state to practice into. I think from a medical side, kind of switching gears, but the patients of West Virginia are very grateful. Certainly there's pockets of need of care throughout the state, and they truly, they truly are great patients to take care of, and they certainly are happy with the care they get here, despite the travels they do to get to see us. So we're actively recruiting every year, 3 residents a year at this point for our program. We certainly look forward to hearing from anyone who wants to apply or has any questions. Feel free to email, call, reach out to us so we can inform you of our program. We certainly invite those students who are applying to come as away rotation. We provide an excellent away rotation education process. You get to know our department. You get to really work hand in hand with our excellent faculty and get to know our program. So we're always welcome students to come rotate with us, and certainly encourage them to apply to our program.